Do you want to start, Carolina? I don't mind.
Should I start? Okay, so I'm an occupational therapist. I work as a manager at the hyperacute rehabilitation unit at the Walton Center Hospital. And I think my role is basically trying to promote the independence to the patients that we see. Normally the type of patients we see in this unit is something where they are at the first stage of rehab. So it's when they just left ITU and they're just starting to start starting to get a little bit better, but they have a tracheostomy in place. So we start with the first stage of rehab. And as an occupational therapist, the things you're going to be looking at is trying to promote their independence, try to improve physical aspects as much as the cognitive aspects for the patients. And also looking after their mood and trying to help them to gain the same level of independence they had before as much as possible. So that's the first stage. Occupational therapy in general, so that is just what I do at the moment. But as an occupational therapist, you have different fields to work for. So you can work in the primary care, so in hospitals, in acute setting, or in schools, or in community patients home, and trying to promote independence in whatever occupation they are. Nowadays you can also work in vocational rehab, trying to get them back to work. So there's a vast field to opt for, and normally the training for occupational therapists in this country is for an average of 3 years. I think if you do a master, it might be a bit shorter. And you can work both as in adults, with adults, or in pediatrics, and you can work in mental health, or you can work in physical health. There's also plenty of opportunities now for allied health professionals to work in the academic side of things as well, in research. So it's quite a vast place, kind of area to work with. In terms of my journey, I'm Brazilian and I was graduated in Brazil. But as an occupational therapist, you can work in different countries. In this country, you can work, is not required a specific training or certification, except from the HCPC and the RCOT, which is the bodies, the health professional body or the occupational therapy body. But to work, for example, in Canada or in America or in Australia, you might have to do a specific test to be able to work there, an examination and so on, an exam to work there. I started working as an assistant. So to work as an assistant occupational therapist in this country, you don't need any qualification, specific qualification. Which is great because you can have a taste for it, So when I came to this country, because the training here is slightly different, and what occupational therapists do here is slightly different from what we do in Brazil, it was a great way for me to start. So I started working as an occupational therapy assistant in London at St. Thomas's Hospital, and then I moved into the Great Ormond Street Hospital to work with pediatrics, and I made my way into neuro rehab, which is what I like to do, is my passion. But is normally once you leave the uni as an OT, is a good thing to, in terms of tips, is a nice thing to kind of look into apply for a rotational post, because you can have you can gain a generic kind of experience working in different areas until you made your mind of what area you want to specialize on. But it's a very rewarding profession, I find, where you have lots of contact with patients, very holistic. There's tons of things. I think it gives us a great umbrella of what you can do. As I said, you can work in so many different areas. You can work with learning disabilities, you can work in the hospitals, or you can work, nowadays you have autism in A&E or ITU. You can work at home, doing rehab at home with the patients. You can be trying to get them back to work. There's so many places that you can do. So it's a very versatile profession, I find. So I think that's mainly what I could bring. Yeah. Don't know about you, Jess.
Yeah, so I won't talk too much about the job I do because me and Carolina are on the same team, so it's rather similar. But my background is very different. So I'm 20. Gosh, I forgot how old I was then. I'm 24. So I've been qualified now for just over 2 years. Occupational therapy, you'll talk to a lot of people that will probably say like they knew they wanted to do it really early on, but I'm not one of those people. I didn't really know what I wanted to do. I knew I fancied doing something medical. As a kid, my mum and dad had this like medical encyclopedia that I would read before bed because I was a bit of a geek. But I was dreadful at chemistry. Like GCSE chemistry was not the one for me. So I thought medicine's off the cards. I was also quite squeamish. I'd faint having blood tests and things. So I thought, oh, nursing's off the cards. And I wasn't really sure what else was out there because I think that doctors and nurses are the two main professions that everyone thinks of when it comes to medicine. But I actually just got chatting to somebody whose daughter was studying OT, and I started asking her a little bit more about what that involved. I'd never even heard of it. And the more she said, the more I thought, I could see myself doing that. So as Carolina says, it's all about helping people to get back to doing the things that they want to do or the things that they need to do. And I think what I liked most about that is the range of places you can work and the range of ways you can work. So you could go right down to tiny little children, so helping a child with cerebral palsy that needs to start school. You could have someone at any stage in their life that maybe has an accident, breaks their leg and needs to get walking again. Or you can have like older people that want to be able to stay in their home and make themselves egg on toast. Really, really varied things that you can do. I was kind of scared because I was applying for a degree where there was one set career, and that felt really, oh, I think my connection's going. Let me know if it does. That was really scary for me because at 17 to commit yourself to doing one career, that's quite big. Meanwhile, I had friends that were doing like biology, and I'd say, well, what are you going to do afterwards? And they're like, oh, I don't know, I'll see what I fancy. And I felt a bit nervous that I was going down quite a defined path. But the fact that I knew at the end of it, I'd have lots of options and lots of ways I could take the career. It wasn't one specific setting, one job that I would do until I was retired. I can chop and change. I'm still really early on, like there's plenty of room for me to say, actually, I want to try something totally different now. And that's what makes me feel like I've made a good choice in where I am. So education-wise, normal GCSEs, my A-levels were maths, biology, geography and English. So bit of everything. You can tell I was quite indecisive. And then I just went straight on at 18 to do the occupational therapy course at the University of Liverpool. So really local to you guys. So I can see a question there about medical school. So it's not medical school, it's just at the University of Liverpool, based with everyone else. And the degree is specific to occupational therapy. It's not a general medicine or healthcare degree. It teaches you lots of very specific things about the profession that we've gone into. What was really interesting was that on the course, there was a real mix of people. There was some people like myself that had gone straight into learning that at 18. And then there were some people that had taken a couple of years as just a gap year, done a bit of traveling. There were some people that had already done another degree and then thought this sounded like what they wanted to do. And there was quite a few people a fair bit older actually that had children or had had one career and sort of fallen out of love with it and decided they wanted to completely change things around. So it was a really mixed bag there. My one piece of advice, if you're thinking about going down this sort of road, would be to do some volunteering. I did loads of different volunteering between the ages of 16 to now, really, working with all sorts of populations, because I think working in a healthcare setting and working with vulnerable adults, children, it's something that you don't know if you're going to be good at until you give it a go, really. So I would say if you've got any opportunities to work in those kind of settings, now's not a great time, but when the world starts to open up again and you think maybe it might be for you, just shove yourself in that situation and find out. That would be my best piece of advice. Has anyone got any more questions or anything that I've not covered very well?
That was such a brilliant overview. Thank you for sharing your stories with us. It's fantastic to hear just how diverse the routes into occupational therapy really are. Do feel free to put questions in the chat, anyone, if you have anything specific that you'd like to ask. I was just wondering, touching on that kind of work experience and volunteering route, have you got any specific examples of things that you did before applying to this course? I don't know if both of you have experienced that, but it'd be great to hear what you did.
Yeah, I mean, given mine was all sort of done a bit more locally, I'll take that one if that's all right. When I was 16, I was a brownie leader. And then when I was in college, my college was 4 days a week. So on my one day that I wasn't in college, there was a private gym for people that had strokes. And I went and I worked with the physios there, just doing things like setting up the equipment, making cups of tea, chatting to the people. Then I worked at a like an allotment that was for people with dementia, getting them out and about in the gardens, talking to them. I remember that was quite a daunting one for me. I hadn't really got anyone in the family at that point that had cognitive difficulties, and I hadn't met anyone up until that point. I remember feeling quite nervous, actually. I remember the first couple of times that I was left alone with an adult that was very muddled and getting a little bit upset, and I panicked. I didn't really know what to do with that situation. But I got used to it, and the feedback I got from being there was that although I didn't have any particular training, I didn't know what to do, I was able to put people at ease and just deal with it as best as they'd have expected for an 18-year-old at the time. And it gave me so much confidence in just going out there and mixing with people and using those communication skills. I think in all healthcare professions, communication's massive. Occupational therapy, I definitely think it's massive. If you're a good talker, if you can chat, and if you can listen, like listen's one of the main things, then you're probably already ahead of the game. So anywhere that's going to put you around a variety of people that might be different to the people you mix with in your family life and at school and at college, just making you a bit more aware of different people, different people's needs and life experiences, and see how you get on. You might find that you love it, or you might find that actually it's not for you, and that's fine. You need to figure out what works.
I just wanted to mention as well, in terms of volunteering, trying to volunteer for any kind of jobs is good. I did some volunteering as well, just to kind of have a feeling of how it works, and the system works here, and just going to any service and either to do some admin job or anything like that, just because you've been in contact with other professionals or DOTs around, and that helped me a little bit.
Fantastic, thank you both. I know you're going to disappear in a second, but I just want to say thank you so much for sharing those experiences and giving us some advice on getting into this area as well. That's fantastic.
Oh, no problems. I'll be around for the Q&A at the end as well.
Thank you.
Amazing. Oh, I think Jess has disappeared. So we should be getting our next speaker in a moment.
Thank you, Caroline. Thank you.
If anyone does have any questions or any reflections on that session, feel free to put them on the chat, and then we can pick up on them later as well. If there's anything you didn't get around to asking, we can make sure it gets answered in the Q&A later on. Hi, Olga.
Hello.
Nice to meet you. I'll hand over to you now so you can start chatting away and tell us a bit about your current role and your journey to getting there. And I'll keep an eye out if there's any questions in the chat and pass them on to you at the end, okay?
Okay, yeah. I work in the private hospital in Manchester. I'm an imaging manager at the moment. However, I started my journey as a diagnostic radiographer. I did a few years in X-ray. I did some work in MRI department as well. And obviously, I don't know if the students will know the whole pathway and the way how the imaging department works, but general radiography, it's the modality what we use an X-ray to check the bones, for example. MRI is a scan which we do on the patients. We call it like a tunnel, where we do scans on all parts of the body. Yeah, and like I said, I work in a small private hospital in small imaging department where we have MRI, X-rays. We cover the theater cases as well, and we do ultrasound scans.
That's amazing. Thank you for sharing that. Has anyone got any questions for Olga about what she does or anything about getting into radiography as well? I'll just start us off by asking you a question, if that's okay, Olga. I was just wondering if there's any specific skills required for this role that you would recommend that young people would have when applying for a position or a course in radiography?
I've done 3 years at university. With my education, it's a little bit different because I finished university in Poland and then moved to UK. But when I registered with HCPC, that's what you have to do after finishing the course. They compared the level of the education here in Poland, and the course it's exactly the same than in Poland. But yes, you need to do the 3 years of university course.
Could I ask a quick question, please? What would you say, in your general day-to-day role, what would you say your biggest challenges that you have to overcome?
I would say the role is challenging every day, because obviously, at least now when I'm in my role as an imaging manager, I deal with the patients if there are complaints, if anything goes wrong, if we need to order new equipment, or we overbooked, for example. There is quite a few challenges every single day, like everywhere, but I love my job, and I wouldn't change for anything.
So linking back to those skills, I suppose you asked about before, resilience would be a big one that you'd have to rely on, adapting to those challenges every single day.
Of course, yeah.
Amazing, thank you for sharing that. We have got a question from Leah. She's asked, what do you like most about your role at the moment?
Patients. I'm really people orientated, and I always wanted to do something with health. And I know people think that an X-ray is just quick in and out, where we haven't got that much contact with the patients. However, during that I would say quick appointment, we still have to show them how caring and compassionate we are, and obviously we do our best to help them, answer their questions as well. But yeah, I would say caring for people, yeah, that's the best part of the role.
Amazing, thank you for that answer. I think that's a really interesting insight, because like you said, maybe compared to other roles, you don't get to build that much of a rapport with patients because you're not seeing them as often, but it's really important that you are giving them that good service all the way through their journey.
Oh yeah, from the beginning, when they walk into the department till they get report, because we can't forget about what is happening after the patient left. We still have to provide the full report to the physician who requested it.
Excellent. Okay, so we've got a couple more questions.
Yeah.
We're just wondering how you are taught to interpret X-rays, and also how much knowledge you need on anatomy for this job.
we do not report radiographers. You can do the extra course after you finish your radiography, but you do need to have a good few years in general radiography experience to do that extra course. To be able to interpret X-rays, in most of the hospitals, for example, in ours, we've got radiologists. That's the consultant doctors who report MRIs and X-rays. In regards to the second question about the anatomy, yes, you do need to have quite, good knowledge about the anatomy, and that it's included in the university course.
Fantastic. Thank you for letting us know about that. We've got a couple of minutes left with you, so if anyone does have any more questions, feel free to pop them in the chat. I was just wondering what the university course looks like, if you could tell us a little bit more about your time at university and the kind of different areas you studied. So you've mentioned that you've done a bit of anatomy. Oh, we've just had another question that might be more interesting than my one. What's the worst thing you have X-rayed?
I think I wouldn't say a thing. I would say a case. What I X-rayed, it was post accident an X-ray on a biker. And yeah, it can, those cases can be quite challenging, for when you've got really ill patients and you have to do it as quick as possible.
Yeah, absolutely. It does sound like a challenge. Thank you again for sharing that with us, because it's a really interesting insight into the kind of things you have to do and the pressure of the situation at certain points as well.
You can't, to be honest, especially in A&E, there can be really challenging cases where you have to think out of the box, because obviously they are cases where you wouldn't be learning about during the course. Obviously the course will prepare you for it, but yeah, they are quite often very challenging cases, and what makes that job even more interesting.
Absolutely. Thank you so much for your time with us. I think Olga's just gone off to our next group now. We'll have a couple of seconds until our next speaker comes, but I just wanted to say thank you again for everyone submitting really great questions. Please do keep it up, and if you think of anything that you'd like answered, do pop it in the chat. Anything we don't get round to, I'll send over to Sarah to ask in the Q&A later on. But yeah, fantastic questions so far, so do please keep that up.
Suppose just while we're waiting for another volunteer, if any students come across a career today within AHP that they didn't know anything about and are interested in, potentially going into that role, does anyone put any thoughts on that in the chat?
Hi, Greg.
Hello, you okay?
Yeah, welcome. We've got lots of fantastic questions been asked by this group already. So I'll hand over to you to introduce yourself and your role and your journey. And I'll ask you any questions that come up in the chat as we go along.
Yeah, of course, no problem. So my name is Greg Andrews. I am a therapy radiographer. So I'm not sure how much you know about that, but there are two types of radiographer. Both use X-rays, which is what the radiographer bit is. And then therapy, which is what I do, is treating patients, and diagnostic is basically diagnosing things. So if you go and break your leg in A&E, you'll have an X-ray by a diagnostic radiographer. I'm generally involved in treating cancers. We do treat some non-cancerous conditions, but 99.9% of what we treat will be cancer. And the difference is that with therapy radiography, you use very high energy X-rays because we need to penetrate tissues and we need to damage DNA that are often quite deep into patients' bodies. So the difference for patients is that they come in for quite a number of visits. So, for example, they come for a planning session, and then it could be anything from one treatment to up to 7 weeks of treatment. So 37 treatments is one of the longest courses that are offered around the country. Now, the benefit of that is that you get to meet a lot of different people, you get to build relationships with them, you get to help people. You're always in that, still getting that care aspect if that's something, you know, that interests you, like similar to nursing, because we have to manage lots of side effects. And you get to meet and help people at a very important time in their life. In terms of what we do day to day, a patient will have already had their planning session, and that is something that therapy radiographers get involved with. But in terms of delivering the treatment, patients will come, we will get them into a treatment position. They lie on a very uncomfortable flat carbon fiber couch top, which can be difficult for some patients, but we have to keep it carbon fiber so that the radiation isn't basically doesn't deteriorate as it's traveling through. Then most patients have tattoos, so tiny little dots, which are given to them when they have their planning session. And then we align them to some lasers that we have in our treatment room. And that shows that they're in the same place as when everything was planned. And then we'll run outside the room. We'll take a quick scan or a quick X-ray just to check that the patient's in the right position, and then we'll deliver the treatment. So whilst the treatment is ongoing, there's nothing to see, there's nothing to feel. We can't be in the room with the patient, so we're outside watching them on camera. And the whole treatment is generally done quicker than 5 minutes. So most patients are only in the room for about 20 minutes. We probably treat about 20 patients a day. And outside of that, there's lots of admin tasks. You know, it could be doing all the bookings, the appointments, doing follow-up phone calls, things like audits, risk management, all that sort of stuff. We're quite quality driven. So there's lots of work instructions and those sorts of documents to keep up to date. In terms of how to become a therapy radiographer, I did a 3-year BSc at the University of Liverpool. You can do, I think, a 2-year PG dip if you've already got a degree. And I think you can do a 5-year part-time course. I don't know about that anymore, though. You used to be able to. Not sure if that's still an option. When I went to university as well, there was NHS paid tuition fees and bursaries. So that was obviously something that helped dramatically whilst I was at university, because it is quite a busy course. I mean, it would be difficult to have a job alongside it because you're in university pretty much all day. And then you have to learn the clinical side of things. So that is done during your clinical placements. So anything that anybody wanted me to ask or elaborate on?
That was an amazing overview. Thank you for sharing.
Thank you.
Really interesting to hear about the day-to-day role you have, and also how you came to be in this position as well. So that's fantastic. We have got one question in the chat so far, so thank you for submitting that. It's, do you tend to form strong relationships with your patients because of the treatment you give with cancer? And
yeah,
like
absolutely. That's probably my favorite part of the role. It's difficult sometimes, obviously, when you know, some patients not very well, and quite often you can see if you work in a very big department, it can pass you by. But if you're in a small department, patients can become, you know, return visitors. But yes, absolutely. Over 7 weeks, you get to know people, and these are people from all walks of life. So it can be any sort of profession, you know, any sort of class, if that's the right term you want to use, and you make friends basically. And these are people who they're going through a lot, because obviously they're going through cancer treatment. So you do have some really meaningful relationships that you build, and you know, you get to, you know, learn a lot from patients and their experiences. So isn't radiography dangerous? It would be dangerous if we didn't have lots of safety. Forgot the right word to use, but it is very safe basically. So the treatment room we term as a bunker, so it has very thick walls so the radiation can't escape, and we can't be in there to deliver the treatment. It's not physically possible to press the button on the outside which starts the radiation unless you've set the security, which means you've left the room. The only way it would be possible is if someone trapped you in the room basically, but then there are lots of buttons. You can touch any part of the machine and it would turn off. So there's a lot of safety around it, and obviously quite rightly, because yes, if you were exposed accidentally, it would be a significant dose, and we wouldn't want that without obviously directing it at the cancer that we want to direct it at. Is there staff wellbeing support available? It would depend where you work. So the broad answer will be yes, but I can't speak for every health industry sort of organization. The company I work for is very good. They offer, psychological input. They offer, sessions that people can go, I think they're called Swartz rounds, where you can go and discuss something that's happened, and lots of professionals will input into how they would have managed it, how they feel you can manage it differently in the future. And obviously people grow and learn by sharing those experiences. So there is a lot of wellbeing support. We've, especially recently with the pandemic, we've got lots of access to mindfulness, whether it's as a session or just via apps, lots of ways to manage anxiety, those sorts of things. So yes, we are well looked after. Like a lot of those things, they aren't necessarily taken up, but when you take them up, you do find that they're very good.
That's fantastic, thank you. And thank you to everyone that has submitted questions. They were excellent things to ask. Do feel free to add any other questions that you have. We've got a bit more time with Greg, thankfully. I was just wondering, yeah. Greg, you mentioned that you did radiography at university. I was wondering when the first time you heard about this career path was and what made you interested.
So it was when I got a job in the radiotherapy department. So for example, it's not that well publicized, or it wasn't when I went to university, because my dad had radiotherapy when I was younger, and I still didn't really know what it was until I got a job within the radiotherapy department. So it is definitely a bit of sort of, we're hidden away, and quite often radiotherapy departments are actually in basements of hospitals. So it's not just that we're hidden away from the public eye, we were hidden away from the career eye as well. But it was when I got a job and was on the administrative side and realized that, this is a job that essentially has everything. You've got differences every day, meeting different people, but then there's a lot of scope for career progression. It's a job that is, we were key workers, so there's a lot of scope, and a lot of benefit there, that you're going to have a job for the future. It's not necessarily a dwindling industry or anything like that. There are always people. We're currently getting lots of technological advancements that are certainly going to mean radiotherapy is useful for the next 20, 30 years. It's not only used to treat cancer, but mainly. It used to be that they would use it for a lot more benign conditions, but they've come away from that now, because radiation, you don't really want to use it unless you absolutely have to. But there is a condition called Dupuytren's, which means basically your fingers go like this and you can't straighten it. So if you have radiotherapy, you can still have surgery afterwards. So radiotherapy and surgery can help. You can't cure it, but they can help minimize the effects of it. So that's one that we do quite commonly. And some brain tumors technically aren't cancer, so we treat those as well.
Thank you for answering those questions. I just wondered if, to finish off, you could maybe give us a piece of advice for getting into this career path, or for a allied health profession in general. That'd be fantastic.
I think in terms of advice, you can't really go far wrong with becoming an AHP. It is a great job that I think has everything. It has that customer service side of things, but it also is bolstered by the scientific side of it, because lots of scientific jobs don't have that face-to-face patient contact that you'll get in healthcare. The best advice really will be to go and get some work experience. If you're not sure whether you want to be an occupational therapist or physiotherapist, go and do some placements. Most teaching hospitals, if you can get in touch with the department, they'll put you in touch with the education lead. So for example, we have a superintendent radiographer who's an education lead, and anyone would be able to direct you to that person, and they'll happily be able to set up sessions for you. And you can come and spend a day and learn you know, what it is. And you could go and be a physio for a day, an OT for a day, you could do diagnostic for a day and therapy for a day, and, you know, really make the choice based on that. That would be the advice that I think I would give, because not many people know what the job is. And, you know, it's great being able to describe it here, but with something that's so machine based, you need to go and look at it, really, I think.
Great advice, thank you. I think work experience has been a bit of a theme throughout today, stressing how important it is. So it's fantastic that you agree with that message and you think it's really important. Obviously, there's challenges at the moment as things are going more virtual, but there's opportunities like this which obviously go towards people's CVs and experience. So
absolutely, and get on YouTube, you know, type radiotherapy into YouTube, you'll get pictures, videos of people being treated, videos of the type of machines we use, and it'll definitely help just give you that basic knowledge until we can get you back in the hospitals and show you what we do.
Oh, thank you so much for your time. We really appreciate hearing from you. It's very insightful. I think
you're
going to disappear in a second off your next room. Oh, there he goes. That was really interesting, wasn't it? I think I learned a lot in that session, as I have in all the sessions. If you do have any thoughts or reflections on that, please do put them in the chat. Had some brilliant questions in that one as well, so thank you for contributing. We'll just wait for our next speaker, but if you do have any questions or anything that you want to feedback in the chat, please do that. Hello.
Hiya.
Thanks for joining us. I'm Shannon. I'm going to be quiet in a moment and hand over to you so you can start chatting away about your current role and your journey. I'll keep an eye on the chat and let you know if any questions come in for you, and we'll address those at the end if that's okay. But I'll hand over now.
That's brilliant. I'm just wondering if my colleague Paul's in the chat as well. I can't see him, but he's been in the last few with me. But I don't know, maybe he'll join in a minute.
Hopefully he'll pop up in a second. I'll let you know if he comes in.
All right. So hi everyone, my name's Jordan. I'm a speech and language therapist. So I work as part of a team called the Specialist Support Team, and we work alongside different professionals. So we've got occupational therapists, social workers, support workers, psychologists and learning disability nurses on our team. So what we do, we kind of cover two areas really. So we've got, we work with individuals who are at risk of coming into contact with the criminal justice system. So they might be at risk of going into prison. We also work with individuals who are at risk of being admitted to hospitals. So it might be that they've got really severe mental health difficulties. They might have been detained in hospital as well, and they're receiving treatment. So that's kind of the two major areas that we work across at the minute. Just a little bit about me and how I got into my role. So I kind of came in there a bit late, a bit later on in my career. So when I was at school, I didn't really, no one would come and talk to us about speech and language therapy. It wasn't something that I'd ever really heard about. I think I had the impression that it was teaching someone how to speak properly, which I wouldn't have been good at at all. So that's kind of that was my understanding of what speech and language therapy was at the time. I was really interested in psychology at school, so that's kind of where I started off. So I studied psychology at university, moved over to Manchester from Ireland, did my psychology degree. I kind of worked odd jobs in bars and restaurants during that time. Finished my psychology degree, and I still didn't know what I wanted to do. So I knew I wanted to make a difference. I knew I wanted to do that kind of caring role. So I went into support work, and that was with adults with a learning disability. So that was kind of, I guess, my first experience of working with people with communication difficulties. I remember supporting this one lady who had Down syndrome, and she was using Makaton to communicate. So that was kind of, she taught me how to use the signs. So Makaton's a bit like sign language, just in case you haven't come across it before. So that's kind of, I guess, for me, that was really the starting point where I knew that I wanted to do this as a career. So from that, I wanted to get more experience working with children. I was volunteering at a young carers group at the time, so I wanted to get more work experience. So yeah, I went and did a job as a teaching assistant in a school for complex needs. A lot of the children had really complex communication needs. A lot of them were non-verbal, so they didn't have any kind of language, any words at all. So a lot of their communication was through alternative means. So it might be like using communication aids, so a bit like Stephen Hawking's, using them kind of devices to communicate. Some of them use sign language, some of them use pictures. So it was really kind of eye-opening, looking at the different ways that people can communicate. And because we worked really closely with speech and language therapists in that school, that's where I really, got a flavour of the job. So while I was working at the school, I applied for master's courses. So you can do, I think it's like a 2 years master's if you already have a degree. And master's that I did was specifically for psychology graduates, but I think at the minute they will take kind of anyone with a degree. Or you could do the 4 years undergrad. 4 years at the time just seemed a bit too long for me, so I opted to go for masters. I think they've actually condensed that now, so I think it is a 3-year course, or I know that you can do apprenticeships now, which is a really good option, I think. So I didn't get through. I didn't get through the first time. I kind of got shortlisted, and I didn't get a place, which just made me more determined, really, to try again. So I kind of took a step back. I got a job as speech and language therapy assistant, which I loved. I was working with adults with a learning disability in the community, and I absolutely loved it. I ran my own signing group, and I worked a lot with people using communication devices. I just absolutely loved it. So I applied again the next year, and I managed to get a place on the course. So from that, I did the 2-year course, and my first job, I've been qualified about 2 years now. So my first job was working with children, and that was in mainstream schools. So I was based in different schools during the week, and I would run a lot of kind of early language groups, early communication groups, and that was with nursery kids, reception age kids, and then the other side of that role was working with older children with autism. So a lot of the work that I did there was kind of working on their social communication, so supporting them with that social interaction skills, and that could be group work, it could be one-to-one therapy work, but it's kind of from there that I got really interested in working with autism and mental health, and I guess that's what kind of got me into the role that I'm in at the minute. So yeah, I think that's all. Usually Paul comes in about now, but I don't think he's here.
I don't think Paul's managed to join us now, but thank you so much. Oh, I can hear myself. Thank you so much for that overview. It's really great to hear about your journey and about how diverse the role is as well, and the different areas you can go into. Hopefully we'll get a couple
Yeah.
of questions in the chat, but I just wanted to start off by asking a bit more about working with children. Is that something you specifically wanted to do, or is that a direction that the job kind of took you in?
Yeah, so I guess when I qualified, I was kind of on the fence, to be honest, because I guess with my placements, I loved, you know, the placements working with children and with adults, and I'd already done some work with the adult learning disability team as an assistant. So I guess I was kind of on the fence. I didn't have, some people have really kind of specific areas that they want to go into. A lot of my friends did, but I just loved them both. So I guess when the jobs were coming up, there is more jobs working with children in schools, I would say. But I guess when the jobs came up, that was, yeah, I was applying mostly for children's jobs, probably just because they came up a bit more often. But yeah, I was really on the fence. But it is, I think you're right, Shannon, is it? It is a really diverse role, and every job's really different. So my job working with children in schools is completely, it feels like, it doesn't even feel like the same career really as the job I'm in at the minute, working with adults who are maybe coming into contact with the police or in a psychiatric ward. It's completely different, but it's still the same job, which is weird.
Amazing, thank you for that insight. It's definitely something worth thinking about, whether you want to specialise with children or adults, because obviously they have very different needs and different approaches as well, don't they? We have a question in the chat that's come through from one of our students, just asking about your psychology degree and if that helped with your career.
Yeah, I think for me, because the master's that I did was specifically for psychology graduates, so I think a lot of the time the course itself has a lot on child development and I guess like the psychology around that. So for me, yeah, it was really useful because that part was kind of left out of the course because we were all psychology graduates and they didn't go into deeply about the psychology. Yeah, so I think it was definitely useful, but I don't think you need it to do the masters at all. Yeah, it was just, I guess in my role at the minute, it's really useful because a lot of my psychology degree was thinking about mental health. So I guess that really helps me at the minute.
That's fantastic, thank you. At the start, you mentioned about the kind of crossover with working with multidisciplinary teams and working quite closely with psychologists and occupational therapists and people like that. So could you tell us a bit more about how that crosses over with your work?
Yeah, so the team that I guess we work really closely with other members of the MDT. So we do quite a lot of joint work in our team. We work really, really closely. I know it's different across teams, but so just an example, myself and the psychologist from the team here, we did a block of therapy, and that was around supporting a person's emotional regulation. So it was by identifying and expressing emotions, and we worked together on that. So it was a joined up approach. So we do a lot of that joint working with other professionals in the team. A lot of times we might provide training to ward staff or to police officers, and a lot of our training would be that joined up approach as well. So just so that we can get, because these individuals that we work with are really complex, and it's probably not just speech and language therapy that they've got involved. They probably do have input from psychology, occupational therapy. So for us, the joined up approach really, really works well.
Fantastic. I don't know why I can keep hearing myself. Thank you so much for sharing that with us. That journey that you shared was really interesting and definitely showed everyone the diverse routes, and that you don't have to go straight into a certain career. There's lots of interesting work experience you can pick up on the way that really helps you as well. So thank you so much for sharing that with us.
No worries.
I think we're going to pop back in. Oh, sorry.
No, I was just going to say, I think you're right, Shannon.
here. Just try and get that. Is that working?